Hello, welcome to Gaini Community. What is the significance of Nidana? Why Nidana knowledge is important? Those informations we are going to learn in this particular video. When you think about the significance of Nidana, first of all, we need to know about the possible sources of entry of Nidana. For that, we need to know about the Bahya Srotas as such. When you think about the Bahya Srotas, males are having 9 Bahya Srotas and females are having 3 extra Bahya Srotas as such. And when we are knowing about these informations, so these Bahya Srotas, they will be having the manifestation of Lakshana first. For example, if the Bahya Srotas, specifically NASA, nose is being exposed to the etiological factor, first and foremost Lakshana will be observed in the nose. Then if the person is having the exposure of the Nidana into the eyes, the first and foremost exposure will be observed in the eyes. The first and foremost Lakshana will be observed in the urethra if there is the entry of the pathogen is happening via urethra. First and foremost Lakshana will be observed in the vagina if the exposure of this Nidana will be happening in the vagina as such. So like that, the first and foremost Lakshana will be observed in the Bahya Srotas first. Then we are going into the Abhyantara Srotas affliction as such. So that's why we have to know about the possible exposure of the pathogen is taking place in which particular Bahya Srotas and which particular Abhyantara Srotas is being afflicted. That has to be known as such. That is the main knowledge that is essential to know about that. Next, about the what is the function of Nidana that is going to take place. When you think about the exposure of the Nidana, as such, first and foremost, we are going to observe dosha prakopa, or otherwise abnormal increase of dosha will be taking place. The person is going to consume the curds as such. First and foremost Lakshana will be observed in the mouth region itself, such as the irritation in throat, etc. Or if the person is going to consume more amount of the, we say that the amla rasayukta dadhi as such, or would you say that the person is going to take more amount of the gobi Manchurian, etc. The first and foremost Lakshana observed in the alimentary canal itself. In this way, abnormal dosha prakopa situation may be taking place depending upon the nature of Nidana Sevana as such. Then that will lead to Dhatu Dushti, that is what you say that affliction of Dhatu may take place. The consumption of the frequent consumption of the gobi Manchurian, etc. There may be a possibility of affliction of Rakta. And the next one, that is the Kavai may be taking place. So that is the dysfunction of the Srotas may be taking place because of the Nidana Sevana session. Then we are going to decode the two important significance of Nidana. That is one, that is the Hetu Sankara, and the second one, that is the Sankshepa Kriya Nidana Parivarjana. Dear ANA community, put a thumbs up and put a bell icon so that the YouTube algorithms fetch you the right information at right time for the right purpose as such, and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Coming to this particular video, we are going to know about the Hetu Sankara as such. That is the first significance as such. So Charaka says, Eko heturanekasya tathaikasyaika evahi vyadhirekasya bahuna bahavo picha. That is, Eko hetu anekasya tatha ekasya eka evahi vyadhehe ekasya cha aneko bahuna bahavo apicha. So that is the one hetu. Suppose if this is considered to be the hetu, if this is considered to be hetu, and if this is considered to be the vyadhi, one hetu is responsible for multiple vyadhi manifestation, whereas tathaikasyaika evahi, one hetu may be responsible for the manifestation of one disease itself, whereas vyadhirekasya cha aneko, that is, one vyadhi is having the multiple nidana as such. That is being mentioned there. Whereas bahuna bahavo picha, multiple hetu will be responsible for the multiple vyadhi manifestation. So that is considered to be the one significance of Nidana. Why we have to know about the Nidana as such. Now we are going to decode about this particular Hetu Sankara. When you think about the one Hetu and multiple diseases, let us look into the Laghu Guna as such, which is considered to be the one of the Hetu as such. The term Laghu Guna, which is being explained by the Acharya, that is, Yat Kinchit Laghavakaram Dehi Langhanam Smritam. So any measures, so they are considered to be responsible for the lightness of the body. That is termed as Laghu Langhana. Langhane Laghu Guna Pradhanyam Neyam. So that is, Laghu Guna is going to get increased in the body there. Langhane Laghu. So that is, all these are indicative of the lightness of the body taking place. So that means there will be the nutrients are going to get depleted, or there is micromolecules are going to get converted into macromolecules, or there may be a possibility of removal of these macromolecules, etc. that is going to take place whenever if you are looking into that particular part. And the Charaka says, Chatushprakara Samshuddhi Vipasa Marutatapo Pachanani Upavasascha Vyayamascheti Langhanam. So here the measures that are considered to be responsible for the lightness of the body are Chatushprakara Samshuddhi Vipasa Maruta Atapo Pachanani Upavasascha Vyayamaha Cheti Langhanam. That is Chatushprakara Samshuddhi, that is Vamana, or we can say the medicated emesis or vomiting, then Virajana, medicated purgation. So that is, we are going to induce the loose stools as such. Asthapana, so that is the medicated enema as such, whereas Dasya, medicated administration of the nasal medicine. Nasal administration of medicine as such. So these are considered to be 4 types of the Samshuddhi. Pipasa, that is considered to be the thirst as such. If you are not taking any of the fluid substances, that is considered to be thirst, is responsible for the lightness. Maruta, that is considered to be the exposure to wind. Then Atapa, exposure to sunlight. Then Pachana, any measures which are responsible for the digestion of the undigested materials in the alimentary canal. Not only in the alimentary canal, other areas, what we can say, the presence of ama in the body, if that is going to get completely digested, that is considered to be Pachana. Then comes the Upavasa, so that is the fasting. That is the fasting considered to be the lightning measure, and Vyaya, that is exercise. So these are the various measures how the lightness of the body can be attained. So when you think about the what is its significance, how this is responsible for the multiple disease manifestations, that is, let us take the example of Vyaya. So what we can say the exercise. So depending upon the nature of the Vyayama, depending upon the degree of exercise, how much time he is going to do the exercise, the person will be having the different clinical manifestations that can be observed in the body. The first and foremost thing, if the person starts doing the exercises, within a matter of 30 minutes, there will be the depletion of the carbohydrate are going to take place. When the carbohydrates may be stored in the body in the form of glycogen, etc., that is going to get converted rapidly. So that within a matter of 30 minutes, that is going to get depleted. In the sense, the body tries to crave for nutrition, so that is considered to be the initial manifestation taking place. In that way, there may be a possibility of a sadhatu involvement. And because of the excessive exercises, the heat generation is going to take place. So that is considered to be responsible for the excessive sweating. Excessive sweating in the sense where the ati prakriti may be taking place. In that particular situation, there may be a possibility of a Svedavaha Srota affliction. So, as the person is doing more amount of the exercise, the fluid is going to get depleted in the form of excessive sweating. In the sense, there may be a possibility of less urine formation. In that way, the person may have the Mutravaha Srota affliction. So, this may lead to what you say that the urolithiasis formation, renal stone formation. In that way, the Mutravasvata affliction may be the initiation. Plus, there may be the displacement of stored fat is going to take place into the circulating fat. In that way, so these circulating fat, as they are comparatively considered to be macromolecules, they are going to get deposited in different parts of the body. In that way, if that particular circulating fat is entering into the coronary vessels, the person may develop heart disease. If these circulating fat is entering into the brain, the person may present with the cerebrovascular accident manifestation, and if the same are entering into the lower limb, the person may present with the pain in the lower limb, etc. Peripheral arterial diseases may get manifested, plus the, the circulating fat, there as they are going to get accumulated in the liver, the person may be presented with the clinical features related to fatty degeneration. See, simply the nature of the Vyayama. So, multiple, depending upon the degree of Vyayama, etc., multiple diseases are going to take place in a particular individual. The Sakshaya may be possible, so the Vahasrota affliction may be possible, Mutravasrota affliction may be possible. Then, depending upon the clinical manifestations, again, different organs or avayava dushti may be taken place. In that way, one hetu may be leading to multiple disease manifestations. So here, this particular adipose tissue, what we can say that is the stored fat in the intracellular fluid that is going to get converted into circulating fat entering into the blood vessels is going to take place. In that way, one hetu, that is simply the Vyayama, will be leading to multiple disease manifestations such. Then, one hetu and one disease. Suppose if the person is having the continuous consumption of the poha here, the two of a same quantity. So for 7 days, what will be the condition of the human body? One Srutas affliction may be possible. So here poha, it is considered to be having the ruksha guna. So whatever may be the water you are going to add, this water is going to get absorbed by this particular dish as such. In that way, if the person is continuously consuming the poha for continuously for 7 days, initially we are going to observe the increase of ruksha guna in the Mahasrotas itself. So may lead to the excessive pickup, etc. that person may present with, or the person may have the thirst as such is going to take place, or the person may have the Shakrit Graha, that's what we can say, the constipation like manifestations may be possible. In this way, the disease, the pattern is mainly concentrating upon the what you say that the alimentary canal cell, or otherwise what we can say the Mahasrotas affliction. So like that, one disease as such may lead to the one disease affliction. Multiple hetu and one disease as such. As we have discussed the multiple hetu. So let us look into the three different examples, that is Virechana, Vyayama and Atapa. When you think about this particular aspect, we are knowing already that these are the measures that are responsible for the Langhana effect or lightness of the body in the as such. When the person is going to consume more virechana, frequent virechana, what will happen? The more amount of the fluids is going to take eliminated via anus. In the sense, the inflammatory part is going to happen in the small intestine as such. When that is happening, the lightness of the body is going to take place differently. Whereas the Vyayama, so the Langhana effect will be seen in the adipose tissue. In the sense, the lightness of the body taking place all over the body itself. And Atapa, in the sense, lightness of the body can be observed because of the excessive sweating. In that way, whenever if you think about it, Langha, all these measures, multiple hetus are responsible for the Laguguna increase in the body. And which particular part of the body, so this Laguguna is going to get increased, depending upon that, the person may develop those sotas vikara as such. When you think about it, so here the because of the Vyayama and Atapa as such, the person may have more and more amount of sweating as such. In that way, the Lagu Guna increase specifically observed in the Svedavaha slokas as such. That means the person may present with Svedavaha slokas diseases as such. So like that, multiple Hetu may be leading to the one disease as such. Whereas multiple Hetu may lead to multiple diseases. Whenever if you think about the Vivechana, as such, the person may develop the Langhana effect specifically observed in the Mahasrotas. In that way, the person may have a manifestation of the Mahasrotas disease as such, wherein the Samanavata affliction or Apanavata affliction may take place. In that way, the person may have Annavaha Srotas disease or Purusavaha Srotas diseases as such. And when you think about the Vyayama, so this Langhana effect may be observed in the adipose tissue. In that way, the diseases may be observed in the Medavaha Srotas as such, whereas the Atapa, wherein the Langhana effect may be observed in the body fluids. In the sense, the person may have the sweating, excessive sweating, etc. In that way, the diseases may be observed in the Svedava slokas such. That means, depending upon the nature of the Hetu, the multiple diseases may be observed as such. In this way, the एको हेतुरनेकस्य तथैकस्यैक एव हि व्याधेरेकस्य बहवो बहूनां बहवस्तथा. We are going to decode this. Now, regarding Sankshepaṭah Kriyayoga Nidana Parivarjanam. So, what is this particular understanding? Whenever if you are knowing about the Nidana, first and foremost, we have to avoid that particular Nidana. For example, so here there is a timeline for the disease manifestation. It is considered to be first day. On the first day, the person is going to consume the Nidana and he is going to get developed. The nth day, some Lakshana manifestation will take place. So here, the patients are visiting to you only after this Lakshana manifestation. So based on that, we have to identify what might be he has taken on the some day, first day itself. If it is possible to identify, immediately try to stop that particular Nidana. What we can say, the Nidana, Parivarjana is considered to be the essential thing, which is considered to be the major line of treatment as such. For example, person is on the nth day, person is having the cough, sneezing and running nose, etc. And on the first day of the person is having the exposure to dust. So that means the first and foremost we are going to know about the Nidana Parivarjana in the sense he has to avoid the dust as such, so that this sneezing, etc., that is going to get diminished in due course of time in a very short possible way. So if the person is developing burning sensation in the epigastrium on the second day, on the first day he might have taken something related to the Mahasrotas. In a sense, we are going to identify the exposure of the Nidana, such as the Krishna Ahara Sevana, or Katu Amla Rasa or Lavana Rasa Ahara Sevana, or otherwise the person has taken the Ushna Guna Yukta, Ushna Virya Yukta Ahara Sevana, etc. So avoid that the Nidana, so that due course of time he may develop the submission of the symptoms or Lakshana, which are considered to be responsible for the burning sensation, etc. That's how Sankshepaṭah Kriyayoga Nidana Parivarjana. To sum up, whenever if you think about the Nidana as such, two main significance we are not going to know about it. Eko heturanekasya tathekasya eva hi vyadherekasya bahu aneko bahuna bahavastatha. So try to identify which particular Bahya Srotas is having the Lakshana. Based on that, we are going to say that the Nidana is being exposed toward that particular Bahya Srotas. Plus, later we have to identify which particular Abhyantara Srotas affliction is there, depending upon the Nidana as such. Then the second major significance is Sankshepaṭah Kriyayoga Nidana Parivarjana. Whenever if you are able to identify the Nidana, try to avoid that particular Nidana itself, so that we can able to give the treatment at the earliest. For that, we need to know about the different Nidanas which are exposed to the Bhakya Srotas, different Nidanas which are mentioned in the text regarding the Abhyantara Srotas as such. For example, Pranavaha Srotas, that is Kshayat Sandharana Daukshat Vyayamat Shuditasya cha Pranavahini Dushyant Srotam Sanyashadaranai. If you are avoiding these Nidana, definitely. So that will lead to pranavaha srotas restoration as such of the abnormal function in that way. And when you think about the Nidana Parivarjana in the sense, we have to identify what are the possible Nidana exposure, which are the different types. Whether the person is exposed to Sanni Krishna Hetu or Vikar Krishna Hetu or Vichari or Pradhanika Hetu. Based on that, we are going to give the suggestion of Nidana Parivarjana so that we can get the remission of the symptoms at the earliest. Or Asatmindya Prajna Paradha or Parinama, or Dosha Hetu, Vyadi Hetu, or Bhaya Hetu, or the what do you say that the Bahya Hetu or Abhyantara Hetu, or in case of the Abhyantara Hetu, whether it is considered to be Urdhva, Adha, or Kriyak Gati, or Vriddhi Sthana or Kshaya Gati, or Chaya, Prakopa or Prashama, or Koshtha, Shakha or Marmasthi Sandhi, or Sama or Nirama, or Ashaya Apakarsha. So these are the different the Nidana that is going to get exposed to the human body. If you are identifying the right Nidana, then suggesting the Nidana Parivarjana to the patient will be easy. Here in a community, what are the major key takeaways from this discussion? Mention in the comment box below. And what is the one video that appear in the coming days this particular channel? Mention in the comment box below. And spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Dear ANA community, put a thumbs up and put a bell icon on the space provided so that YouTube algorithms will fetch the right information for the right purpose to the right person in a right way. Right? Thank you. Something more in the next video. Thank you.